To save the life of a person in cardiac arrest, let's learn how to perform CPR. CPR stands for cardiopulmonary resuscitation. To save a life, it's just two-step process. First, we have to call the nearby emergency center number, and if we find the victim, we must push hard and fast in the center of his chest. So let's see how CPR should be performed. It consists of CAB, simple. Can you see that the C is for chest compression, A is for airway, and B is for breathing. Means it is as simple as CAB. So in CPR, first of all, you have to give chest compressions, push hard and fast on the center of the victim at the lower end of his sternum. Then you have to look for the airway, tilt the victim's head back and lift his chin. And the third step, which is breathing, you have to give mouth-to-mouth breathing to rescue breaths. Now important is how to place your hands and what is the position. First, place the hand over the lower end of the sternum of the patient and make by your other hand a fist over the previous hand, and your arms should be fully extended. Now you can well see that how you have to make fist with the upper hand over your lower hand, and you are supposed to place the palm on the lower end of the sternum and your arms should be fully extended. In the next step, you have to tilt the head back and to lift the chin up to secure the airway. Now ready for the mouth-to-mouth breathing to secure breaths. Now, what should be your goal when you have to give chest compression? How much deep you have to push? You have to push at least 2 inches, and the rate of the chest compression should be 100 to 120 per minute. And breaths should be 2 per 30 compressions. So we can remember the ratio 30:2, 30 compressions and then 2 breaths. Your aim is to push the chest up to 2 inches and then allow the recoil of the chest so that the circulation should be well enough. But if you have 2 persons as a rescuer, then it will become much easier. One of you must give chest compressions and the other should give breaths after counting the ratio, and remember 30:2. The purpose of given chest compression should be a forceful thumb to the heart so that the circulation, which is within your compression range, should be meant for giving oxygenated blood to the brain. Then if you have got ambu bag, you can put the plastic mouthpiece over the oral cavity. And now you can see that after making this position and placing the plastic ambu bag, you can give or maintain the breaths in a well maintained way. Again, you can see the CAB in compression. Focus that your arms should be fully extended and over the lower end of the sternum, and the depth should be up to 2 inches. And you have to visualize the airway in the meanwhile, and then you have to maintain mouth-to-mouth breathing. Adult CPR must include 1 cycle consisting of 30 chest compressions and 2 rescue breaths. So depth of the compression, again I mentioned 2 or 2.5 inches. Rate should be 100 to 120 per minute, so that ventilation rate must be 1 breath every 5 to 6 seconds. While rescuing the breathing, use the head tilt in the way the arrow is, and then lift the chin, or you have to do the head tilt and chin lift maneuver to open the victim's airway, and then you have to blow into the victim's mouth for 1 full second and watch for the chest to raise so that it must be fruitful. So remember that rescue breathing includes in adults 1 breath every 5 to 6 seconds, in children and infant 1 breath every 3 to 5 seconds. In case of a child CPR, 1 cycle again consisting of 30 compressions and 2 rescue breaths. The depth of the compression should be up to 2 inches, compression rate 100 to 120 per minute, so that we can achieve ventilation rate 1 breath every 3 to 5 seconds. Another picture will help you out that you have to give compression depth 1/3 of the chest circumference or about 1.5 inches. The rate is 100 to 120 beats per minute. One rescuer may use the maneuver 30:2, 30 compressions, 2 breaths. But if 2 or more rescuers are available, then 15:2 means 15 compressions and 2 breaths, so that we can achieve 1 breath every 3 to 5 seconds. In case of an infant, just hold the chest with the help of 2 hands and your thumbs will be enough to give the thrust. Recommendations are 2 inches compression depth, 100 to 120 compressions per minute, ratio is 30:2, and 1 breath every 6 seconds. Once you have resumed the circulation and you have to connect with somebody for the hospital, the recovery position should be, you have to put the patient in semi-prone position. This position keeps the victim's airway open and prevent the aspiration of the fluids into the lung, and of course allows fluid to drain from the oral cavity. The emergency action steps for the rescue is you have to assess the situation, then you have to take safety measures first, then assess the victim, call the nearby emergency number, and then you have first aid toolbox with you. Actually, the chain of survival depends upon early contact, giving the chest compression to maintain the circulation so that you may achieve the desired heart rate, then calling the ambulance to take the patient to the hospital so that doctor can assess him well. Sometimes we need a defibrillator to give electric shocks to a person having cardiac arrest, and this is a device in which we have to place chest electrodes, one on the right upper chest and the other on the left lower chest, and we have to give shock in this case to save a patient from the deadly arrhythmias. So a little knowledge about the device, which is automated external defibrillator. It is a portable one. It can diagnose the life-threatening or deadly cardiac arrhythmias, for example VFib and the pulseless VTAC, means ventricular fibrillation and the ventricular tachycardia. When the arrhythmia is present, this AED can give the shock to the heart of a patient to regain its normal rhythm. As you can see, one electrode is on the right upper chest and the other is on the left lower chest. And usually, in case of ventricular fibrillation, we have to give shock at 360 joules. There is another picture in which a case of choking in a case of a kid, we can give the back thrusts by keeping the patient in the prone position until the obstructed element should come out of the mouth. Yes, you can see a picture in which a lady is choking. What a rescuer should do, she should or he must have arms around the waist of the patient, and one fist should be in the middle of the lower end of the sternum above the belly button or umbilicus. The other fist should be above to that, and a thrust should be given in the upwards and backward direction, and 5 thrusts should be given to save the person from choking, and this is called as Heimlich maneuver. Now, how to help a person who is choking? Such a victim needs Heimlich maneuver. As we saw in the picture earlier, we have to stand behind the person who is choking. Number 1 step, then we have to place our arms around their waist, then clench one fist and place it right above their umbilicus. Put the other hand on the top of your fist and pull sharply inwards and upwards. Repeat this maneuver or movement up to 5 times. Then you have to do CPR when if the victim loses consciousness while you are trying to relieve choking, then call the nearby emergency center number. Perform standard CPR with chest compression and rescue breaths we learned earlier. Have a look to the picture again in which you are standing behind a patient by arms clenching around her waist, and your both fists are one above the other, and you are giving a thrust. This thrust must be inwards and upwards, and we have to remove this after the patient is free from the choking substance, and we have to repeat it 5 times at least. Few further pictures will help you remember the Heimlich maneuver. In the first picture, you can see that you are standing behind a choking person and you have to give 5 forceful blows in the middle of the 2 scapula or the shoulder blades that can relieve his choking, or you have to repeat the Heimlich maneuver in the way we discussed earlier until the object is out of the victim's mouth. This picture again reminds us the Heimlich maneuver in these two, and this picture a lady is holding a baby having choking. Either you hold him in a position in which you can lower the head down, and with the help of your 2 fingers you give a thrust in the middle of the lower end of the sternum, or either you put the baby in the prone position and apply thrust or blows on the upper back so that the object should come out of the baby's mouth. Another very good picture so that we can learn choking in case of an infant. Either you hold the baby in prone position giving 5 forceful blows on the upper back of the baby, that is the step 1, or you can give the chest thrust with the help of your 2 fingers, and you have to repeat or wait these 2 steps until the baby has ejected the content which is obstructing his airways, or the person may forcefully cuffs. Okay, another scenario in which you are a victim and no one is there to help you out. So the Heimlich maneuver will be performed like this, that you may lean forward by making fist with your hands as shown in the figure, and you can stand by or bend forward on the back of a chair and apply the same force backwards and upwards to remove the choking. Thank you.